From an organizational managerial perspective, burnout is becoming more common among healthcare workers in Malaysia as the population grows and healthcare demands increase, mainly due to inadequate organizational structures and inappropriate management practice. Healthcare workers in many hospital and clinics and overloaded with work and lack adequate support. The increasing stress on healthcare workers due to inefficient inefficient management system and poor communication has led to recent phenomenon of burnout, which has affected the quality of patient care and our overall healthcare outcomes. The severity of this problem cannot be ignored. If this problem is not solved immediately, the burnout of medical staff will be further aggravated, leading to a decline in work efficiency. In the long run, this will affect the stability and the quality of medical service, and patients will face a longer waiting time for medical treatment and the risk of errors. The entire medical system will become more uh, fragile, ultimately affecting all people who rely on medical service to address the issue of staff burnout. The recommend implementing a new management framework that focus on improving staff support, optimizing workload distribution, and strengthening communication between management and staff. Specific measures may probably include: first, increasing staff support. We recommend recruiting more staff to ensure that each staff member can provide high quality care service under a reasonable workload. This will not only help reduce the burnout of existing staff, but also improve the overall quality of care. Second, flexible work arrangement to help employee better manage work stress. We recommend providing flexible work schedules so that employees have more time to take care of their personal life. Flexible work schedules not only improve employee satisfaction, but also effectively reduce turnover risk caused by work stress. Third, improving communication. Many healthcare organizations experience the communication barriers between management and staff, which result in problem not being solved promptly and effectively. To address this, we recommend establishing clear communication channel to ensure that information can be exchanged quickly and transparently between management and the technical staff. This can be achieved through regular team meeting, online communication platform, or by setting up a detected feedback mechanism. By improving communication, management can understand employees' needs and concern in a timely manner and take appropriate measure to reduce employees' work stress. These measures complement each other and promote the long-term development of the organization by strengthening employee support, optimizing work arrangement, and improving communication efficiency. Medical institution can not only reduce the medical staff burnout and improve employee job satisfaction, but also improve patient care quality and overall medical service level.
Thank you for highlighting the organizational and the management issues that contribute to burnout. Now, let's go one step deeper into how burnout affects not just systems, but the brain itself. From a cognitive and neuroscientific perspective, burnout is not just emotional fatigue. It's a breakdown in brain function. Long-term stress triggers elevated cortisol levels, which disrupt memory, attention, and decision-making. These are essential functions for any healthcare worker operating in a high-stakes environment. In Malaysia, many government hospitals operate at or beyond capacity. Staff shortages are common, and doctors often work more than 12 hours per shift. Under these conditions, healthcare workers are forced to make critical decisions with a tired brain, and that is dangerous, both for them and for their patients. When cognitive function declines, the risks multiply. Mistakes happen more often, diagnoses are delayed, patient outcomes suffer. Over time, this not only endangers patients, it also pushes skilled professionals to quit, further weakening an already strained system. If we don't act, burnout will continue to quietly erode the mental performance of the very people we rely on to save lives. To track this, we propose a cognitive resilience training program adapted from malaria healthcare settings. This program includes mindfulness-based stress reduction, cognitive behavioral strategies, regular neurocognitive check-ins. It can begin with short weekly sessions, either face-to-face or through digital platforms like hospital apps. Over time, this builds mental stamina, reduces reactivity to stress, and preserves decision-making quality. We are not only protecting emotional well-being, we are actively improving cognitive sharpness, which means fewer errors, quicker responses, and safer care. So here's what we need. Hospital leaders, the Ministry of Health, and the mental health professionals must work together to pilot these cognitive programs, especially in high-stress departments. If you are part of the healthcare or academic community, advocate for brain focus, burnout prevention, and support the research.
I want to talk about burnout among healthcare workers, but from a moral point of view. Imagine this. You just finished a light shift. You are completely exhausted, physically and mentally. You drag yourself home and then you get another message asking you to work overtime. Sadly, this is daily life for many healthcare workers. From an ethical perspective, we need to face a simple truth. Healthcare workers are human too. They are limited, but in many systems, it's always patients first, while basic rights and well-being are ignored. That's not okay. It causes a lie. It's a violation of their professional rights. These people deserve to be protected. Hospital and healthcare systems have a duty to provide a safe, fair, and supportive work environment. This isn't just about being rights. It affects patient safety and public health. If we keep ignoring this ethical imbalance, the consequences will be serious. Healthcare workers will feel exploited, burn out faster, and quit more often. The quality of care will go down. Patients will face more mistakes and less empathy. Fewer young people will want to become doctors and nurses, and most of all, people will lose trust in the voice system. So, what can we do? We need to build a clear ethical framework, but more than that, we need to shift our values. Hospitals should take real responsibility for workers' mental health and rest. They should have proper staffing, balance, and mental breaks. Long-term staff should get emotional support and ethical counseling. And society and, and society should stop expecting healthcare workers to get everything without limits. We need to see healthcare as a two-way relationship, caring for both patients and caregivers. Saying thank you is not enough. We need real respect. So system and culture. We must stop letting healthcare workers be silent victims. for a broken system. Their value matters and they deserve to be cared for too.
Did you know that healthy care worker bullying doesn't not just affect individual staff, it can threaten the entire public health system and patient staff safety. From a public health risk bruising among healthy care present professionals has become a prior issue. Currently, healthy care systems are under pressures with high patient-to-staff routines, long worker hours, and demanding environments. Their factor continue to stress and exhaustion among medical staff, which undermines the reliance and effectiveness of public health infrastructure. If present continues unaddressed, the consequence will be severe: increased medical error, higher patient medical rates, and general decline care quality. In the long term, this will lead to overburdened health care system, greater the staff turnover, and reduce capacity to respond to future public health crises, to jeopardizing the health of entire communities. We proposed a comprehensive public health initiative aimed to reducing healthcare worker burnout through system reform. This includes lower patient-to-power ratings, experimental health reports, improving worker conditions, and increasing results. We argue collaborations between polymarkers, healthcare institutions, and public health engines to trust burnout not just as a workplace issue, but as a public health resource. This revelation is sustainable, scalable, and beneficial for both staff well-being and patient outcomes. On the right, we call on decision makers, healthcare leaders, and the Wonder communication to recognize the arguments of addressing bomb and support this individual active and help us build a stronger, more healthy care system for both those who are need care and those who received it.